Good afternoon, everyone. Welcome you all to a session on Introduction to Intensive Care Unit. So, before I start the topic, let me introduce myself. I'm Dr. Chandra Sekhar, Senior Consultant Critical Care, KIMS-Saveera Hospital, Anantapur. So, in the last session, we have discussed about a little bit about the introduction to an intensive care unit. So, what is the ideal composition of an intensive care unit? What are the different types of ICUs that are there, like the medical ICU, the surgical ICU, the advanced ICUs, the respiratory ICU, neuro ICU. So after that, we have moved slowly to how do we actually feed patients in the ICU? How do we put an IV cannula? How do we uh, put a central venous line? So what are the minimum monitoring standards that are followed in the ICU? So in this session, I would like to take a little bit talk a little bit about the additional missions that are used in the intensive care unit. So I have picked up a few selective missions. Of course, there are many apart from what I have picked up for today. So there are many like the EEG monitoring, the Holter monitoring, and the venous pacemakers, transvenous pacemakers. So, but to keep it simple and for understanding for the common public, I have chosen the most commonest of missions that will be available in almost 90% of the level 3 ICUs that I have mentioned before. So to start with, we are going to talk about the ECG mission. So I think most of us must have got ECG sometime or the other. Probably nowadays, most of the insurance companies, when we go for health insurance policies, somebody beyond 35 years of age, usually they tend to take a medical checkup. So the first and foremost thing that they always take in the medical checkup, apart from the routine blood, is the ECG. So ECG is basically a electrocardiogram. Cardia is nothing but heart. So it's the electrical activity of the heart that is read by this mission. So the ones usually standard that are available in the ICUs are a 12 lead ECG missions. So it contains of limb leads as well as chest leads. So we actually place all the things like it is shown in the picture. So the leads are placed exactly there. So six leads on the chest, then followed by the limb leads. So after all these leads are kept, the machine interprets the heart in all the leads and it gives a paper reading of what is the exact cardiac activity of the patient. So the doctor then reads it, and if he identifies that there is any deviation from the normal, the treatment has to be started accordingly. So the next mission that we are going to talk about is the defibrillator. So as the name suggests, defibrillation is a process where it stops the abnormal activity of the heart. So normally what does the heart do? Heart normally contracts to pump the blood to all the organs of the body. So what happens is, suppose a patient has a sudden cardiac arrest or sudden arrhythmias, means his heart instead of beating like regularly like 60 to 100 times per minute, it goes to somewhere around say 150 200 beats per minute. So it starts beating irregularly. Sometimes there is things called ventricular tachycardia or ventricular fibrillation. So all such rhythms need to be reverted with a defibrillator. So if you see the mission over here, so it has two paddles. So that is those are the two paddles. Basically, they look like the handles that are connected with the wire to the monitor. So there is a button knob which can which where you can set the electrical charge that is required. Usually, the charge that we use is about 200 joules for defibrillation. So what we do is we take the paddles and we place it as shown in the picture below. So one will be on the sternum and the other one will be at the apex. So as it is shown in the picture, and it is clearly labeled on the paddles as well, that there is one to be placed at the sternum and the other one to be placed at the apex. So once the paddles are placed over there, then usually what we do is we charge the machine to whatever is the required charge. It is instructed by a trained doctor, either a critical care physician or a cardiologist or a general physician. So they instruct as to what is the amount of charge that has to be kept. So once that, based on that, whether it is defibrillation or cardioversion. So once when we are administering shock, we have to make sure that we are not in touch or any form of contact with the patient. Our skin should not touch to the patient anywhere. So once we move everyone aside, then we shock and try to get the heart rhythm to normal. So this is a very essential mission because most of the times the patients in the ICU, especially coming with chronic kidney diseases or chronic heart issues, usually they tend to get an irregular rhythm. So the moment they get an irregular rhythm, we should have a ECG handy and the defibrillator, as well as the monitor that I have shown in the first part. So we have a monitor which continuously monitors the patient's ECG. So it can monitor two leads at a time. So usually we set the lead 2. So once we set the lead 2, once there are any differences, then we immediately, if there is time, we ask for a 12 lead ECG. If in case of an emergency, we directly start medication without waiting for the 12 lead ECG confirmation. So once ECG is confirmed, either it can be treated medically with injections or any other rate controlling agents, or if it requires defibrillation, then defibrillator has to be kept handy. So this is one of the very important gadgets that has to be available in all the ICUs. So the next one is the ventilator. So as I have told already, ventilator is basically a machine which provides oxygen support, and it helps in ventilation. So ventilation basically means the air moving in and out of the lungs. So what do we normally do? A normal human being always inhales the oxygen that is present in the atmosphere, and then we tend to exhale the carbon dioxide gas. So what this ventilator does is exactly similar to that. So what happens is, suppose the patient is unconscious, or he's having some severe lung issues, or he's having a severe multi-organ dysfunction, or he has consumed a poison, or he has any other neurological issue by which his lungs are not able to exchange this oxygen and carbon dioxide properly, then we put the patient on a ventilator. So what ventilator does is it artificially breathes through his lungs, means it sends oxygen, and through an exhalation port it takes out the carbon dioxide. As you can see in the picture, the air is being pushed through the blue color lumen, and through the pink color lumen the carbon dioxide comes out, and then it's passed on to the. So this basically is a machine which supports the ventilation of the patient. So these are usually the ports that supply the oxygen. They are usually we keep a standby oxygen port most of the times in case in a highly advanced centers. So there should be ideally two oxygen ports, and one is for medical air. So this is a compressed air, and the third one is vacuum. Vacuum is used for suctioning all the secretions that are regularly produced. So once you put the patient on the ventilator, so he doesn't have the reflex to swallow his secretions or to spit out his secretions. So in such a case, you use a vacuum suction. So you pass a suction catheter through the tube, endotracheal tube that is put in the mouth. So through that, you suck the secretions. So this is how the mechanism is. So the ventilator mission, this is the original ventilator mission, and there will be settings on it. So we have to do the settings work, like we have to first check the weight of the patient. So based on his weight, how much ml of gas exchange should be done. Suppose if the patient is say 60 kgs, then we weight like 6 to 8 ml per kg of his body weight. So ideally around 360 to 400, so 450 tidal volumes we put. So tidal volume is the amount of air pushed in a single breath. So we do that, and then along with that we set the rate also as to how many times in a minute they should breathe. So this mission is very, very essential. And the next important mission that we see is the dialysis mission. So you see most of the times the elderly diabetics or people with long-standing BP complaints, usually they tend to end up in kidney problems. So when they end up in this kidney issues, most of the times we try to manage it conservatively by giving them fluids, by changing their diet, not to increase the waste products too much. Then we keep a check on their fluid intake and output. And then we also tell them to take adequate care of their blood sugars and adequate care of their blood pressures. However, if the patient has poor medication compliance, or he's not somebody who takes care of his blood sugar, somebody who's not very very careful about his general condition, or in unfortunate cases, suppose in spite of all taking good precautions, if the patient ends up in kidney failure or some form of arrhythmias, means it can be because of simple increase in the waste products. So then we use this mission. So what the dialysis mission does is, dialysis mission basically takes out the blood from our vein, then it processes it, it filters it through filters and the hemodialysis machine, and it passes the blood back to the patient. So this mechanism is not as simple as it is said in words. And what is it used for other than kidney failure? So other than kidney failure, it can be used in cases of severe poisoning. So suppose the patient consumes a poisoning which in very high volumes cannot be removed through his regular urine or through his stool. So in such cases, usually we use a dialysis machine so that his the amount of waste products can be removed at a faster pace. So apart from that, so it can be used in severe hyperkalemia. Suppose patients with heart failure who are on diuretic medication, means medications to increase their decrease their urine, increase their urine flow and decrease their fluid retention. So all these patients can go for several types of arrhythmias and several types of dyslipidemia, means their potassium can rise drastically. So even in such cases, this mission is handy. So when somebody is started on the dialysis, the question most of them have is it a permanent one or is it a temporary one? So all the three, this and the ventilator, to start with, most of the times they are for temporary support of the patient, means they are not necessary that once you keep a patient on dialysis or once you keep a patient on ventilator, not necessary that they have to be kept on it for a longer time. Sometimes patients recover very fast, or some patients kidney functions recover very fast even with one session of dialysis. There are many patients whom we have sent home, and unfortunately some patients, maybe around 15-20% of them, when they come with an acute kidney damage, say secondary to an infection or secondary to poisoning, they end up in permanent kidney failure. So, but to diagnose it as permanent kidney failure, we have to wait till 90 days as per standard protocols. So this is how a dialysis machine basically works. It draws the blood, then it passes it through a dialyzer after the blood pump. So blood pump maintains the adequate flow of the blood. Then there are some things which are added to prevent blood from clotting. So something like heparin or any other anticoagulants. So the filtered blood is passed to the patient. So this, the one on the right side is a typical dialysis catheter. It's a double lumen catheter, means it has two lumens, one to draw the blood and the second one is to push the blood. So the vein that is kept is, that is an internal jugular vein. So that passes through the neck. So it is a catheter placed in the internal jugular vein. So the next one is the ABG mission. So ABG is basically arterial blood gas analysis. So what we do is we take a sample from the artery, most commonly radial artery. So we just take a sample from the radial artery and put a drop of sample in this machine. So this machine gives us the oxygen, partial pressure of oxygen, partial pressure of carbon dioxide. It gives the lactates as well as electrolytes of the patient. So this is a very, very handy mission and probably the first go-to mission for most of the ICU patients. So it helps us basically in assessing the amount of waste products. It helps us in assessing the electrolytes of the patient, and this is a simple bedside test which the results come in less than a minute. So it helps us in very, very early diagnosis and early treatment initiation. So this is a must-have mission. And the next one is intra-aortic balloon pump. This is a little sophisticated mission which is used most commonly in advanced centers with high cardiology or high cardiac surgery backup. So we use it, of course, with a lesser frequency. We use it for most of the patients who are in heart failure or patients who are waiting for a heart transplantation or patients who have undergone a cardiac surgery and who need some support to the heart. So what this mission does is basically there is a catheter and there is a balloon at the end of the catheter. So it cyclically inflates and deflates. So by this process of inflation and deflation, what it does is it enhances the flow to the all the organs, and uh, it also helps in increasing the flow to the heart itself. So this is very, very useful, especially with somebody who is in severe heart failure or recently undergone any heart surgery, or somebody who's due for a transplantation, cardiac transplantation. So next, and another important mission which has come to forefront after the COVID pandemic is the ECMO mission. So what is ECMO? ECMO is extracorporeal membrane oxygenator. So what this mission does basically, you have seen a ventilator. So what does ventilator do? Ventilator is sending in oxygen and bringing out carbon dioxide. So till one level when lungs are functioning fine, or lungs are doing a good exchange of oxygen and carbon dioxide, then ventilator can be continued. What happens is, suppose in cases of severe lung disease where the lung is completely compromised and the lung does not let the oxygen go into your blood and does not take out the remove the carbon dioxide, then we add this mission called an ECMO mission. So here, if you see the circuit, so we are drawing blood, and again, like in dialysis, we are sending it through a pump, then to a oxygenator. So what does the oxygenator do? It basically oxygenates the blood. So what is the main function that is required for the lungs and the heart? The basic function of the lungs is it takes in fresh oxygen, sends it to all the parts of the body, and it takes out the carbon dioxide and sends it out of the body. So when it is not able to do that exchange, so what this ECMO mission does is ECMO mission uses an external oxygenator. So whatever blood is drawn through the cannula and then passed through the pump as well as the heat exchanger, and then it is taken to the oxygenator. So oxygenator basically provides rich oxygen supply to the blood, as well as it takes out the carbon dioxide through the sweep gas mechanism that is present in the mission. So once the blood is enriched with oxygen, it is again sent back to the patient. So this way, what happens is oxygen, which is the vital nutrient or the vital most vital nutrient in case that is required for the all the organs to survive, is being circulated in the body through an external support from an oxygenator. So this is a very complex mechanism, but this is probably one of the best innovations in the last decade that has come to forefront, especially after the pandemic. So this has helped a lot of patients, especially in severe COVID or severe ARDS, they call it, or severe pneumonias. So such patients, when they have a lung condition where they are unable to supply adequate oxygen, so they might be getting an adequate amount of air inside their lungs, but they are not able to make exchange the oxygen into the blood and carbon dioxide out of the blood. So when they are not doing it, this machine is probably the best option. With this machine has become more and more cost effective. So there are two types of ECMO circuits. One is the veno-venous and the veno-arterial. So sometimes what happens is when I mentioned about COVID or any other conditions, the patients along with their lungs also have damage to their heart. So if they are in cardiac failure, cardiac is heart, along with the lung failure. So then they are put in a veno-arterial, means it supplies both the oxygen along with adequate flow. So in the form of a veno-arterial circuit. Veno-venous, it is basically used for ideally a isolated respiratory failures. So especially when the patients have hypoxemia, where hypoxemia means having a low oxygen levels. Hypercarbia means having a high carbon dioxide levels. So in spite of keeping the patient on ventilator and setting the making the perfect settings, if the patient's oxygen levels is very very low and carbon dioxide is extremely high, then veno-venous ECMO is the go-to solution. So with this, I will end today's session. I would like to continue this session further in our intensive care unit introduction. So I would like to take you through the procedures, common procedures that are conducted in the ICU, as well as the most important thing that most of the people always ask us, the nutrition in ICU. Along with that, I will discuss a little bit about the myths and conceptions that are commonly there when most of the patients and their attenders come to the ICU. What are the common myths or common doubts that they have, and how do we deal with it, and how do the family members actually deal with all such things? So, thank you all for joining. I hope I'll catch you again in the next session. Bye bye.